Lane, and the South Ring Road eastbound is slow passing Junction 6 Cork Airport and again between Junction 9 Bloomfield and the Jack Lynch Tunnel. In Limerick, the Dock Road inbound is slow from the Green Park Road roundabout to St Alphonsus Street, and O'Connell Avenue has outbound delays between the Model National School and the Ross Bryan Road Junction. And that's your traffic and travel news for this evening.
Ruth, thank you very much for that. Now, from today, masks are no longer required in all healthcare settings as new guidance from the Health Protection Surveillance Centre comes into effect. However, ahead of a conference tomorrow looking at tackling long COVID in Ireland and the long-term consequences of a COVID infection are being highlighted. Discussion is due to centre on the need for additional services to be rolled out for long COVID patients and further research pathways. Well, we're joined for more on this now by Jack Lambert, Professor of Infectious Diseases at UCD School of Medicine, and Sarah O'Connell, who is a parent and advocate for long COVID. And you're both very welcome to the programme. Jack, I might come to yourself first. And face masks no longer being required in healthcare settings from today. It's something that's been criticised by the Irish Nurses and Midwives Organisation, amongst others. I wonder, as a consultant in infectious diseases, what do you make of the decision?
I think it's a bad decision. I mean, the reality is immunocompromised people come to the hospital for outpatient appointments. The healthcare workers are the highest source of COVID transmission because they continue to be exposed and get infected. To say that you only isolate if you've got symptoms, if you're a patient, you only isolate if you're a doctor or a nurse if you get symptoms, that's the recipe for disaster. And I think we're going to see more people infected, more people ended up in the hospital with COVID, and then finally, even if you don't end up in the hospital, you have a 10 to 20% chance of getting long COVID. So it's a major decision that's going to have significant ramifications, I believe, in the next month or two. We'll see.
What is the latest research on how effective masks are at preventing transmission of the disease?
Well, people fight about this all the time. There seems to be the politics of using a mask. If you sneeze in somebody's face, you're more likely to get infected if you sneeze to the side. I mean, it's just common sense. If you cover your mouth, you're less likely to spread it than if you cough in somebody's face. If you have a mask, is it 100%? Absolutely not. But it's preventing the spread of all sorts of infectious agents from your mouth into the environment, and then somebody is going to inhale that. So they're not 100%, but there's unequivocal evidence that masks work if used appropriately.
Okay. Now, long COVID is being discussed at a conference tomorrow, as I mentioned, and that is looking at the priorities and the next steps that are needed to address the impact of long COVID in Ireland. Can you talk to us about what those priorities are?
Well, first off, we've had this data for a year and a half, and all of a sudden the HSE wants to do another study to see if long COVID is a problem in Ireland. We know it's a problem, okay? And the situation is hundreds of thousands of people are getting long COVID, and there currently is no referral pattern that GPs are aware of where patients get seen, where patients get seen quickly, and then patients are often just seen once and discharged. I mean, there really needs to be a service that provides support for people until they're better. There needs to be income protection for people who get long COVID, and like I said, there needs to be centres that actually are fit for purpose. The centres that were put together primarily by pulmonary doctors, consultants, and infectious disease doctors. And the major problem with long COVID is neurology. We've got a shortage of centres to support neurology, and we've got no centres to support children and adolescents. So, and then finally, of course there needs to be money going into it, but this is 3 years old. We knew this 2.5 years ago. We should have put together a funding stream to do better research and then to provide more multidisciplinary services for patients throughout the country, who are at risk for acquiring long COVID.
And on that issue of research, any time I have discussed this, one of the things that keeps coming up is that we really don't seem to have a good sense in terms of data of the scale of this problem, or indeed the severity of this problem. But my understanding is that of what we know, up to 5% of long COVID patients are still suffering from symptoms a year after catching the virus. Can you give us a sense of what you're seeing in terms of patients presenting with the symptoms and how many have really difficult long-term effects?
Well, that's the reality is, we haven't longitudinally followed up people. That's the issue. Now, we did a study at the Mater going back to 2020, and at 1 year, 10% of people were still sick. And we're in the process of going back to find those 150 to see, what percentage are still very unwell. But I've been following these people in my clinic since June 2020. So this is 3 years now. And for example, I saw 9 patients today. I'm seeing patients privately now because my public clinic closed. But in the private patients I saw, there were 4 new patients. I've been sick for a year and a half. And there was about 5 follow-up patients. And a couple of the patients have been able to make it back to work. But, one of them is totally incapacitated, a nurse. Another one's an ambulance driver who was infected on a job, and he's totally incapacitated and being told to go back to work, and his, income's going to be taken away. So we still don't know the extent of the numbers of people who are extremely incapacitated years and years after COVID. But there's data all over the world. 10 to 30% of people are still unwell at 1 year. And I would say 1 to 5% are incapacitated, unable to go back to normal function a year, sometimes 2 years and 3 years post their original infection.
What about children, Jack? Are there specialised services for children, or is that something that we need?
Well, we do. We absolutely do. And the announcements have come back in previous years. Kids don't catch COVID. Kids aren't at risk for COVID. Transmission. Kids don't get long COVID. Kids do get long COVID. And I'm actually seeing, I'm PEDS qualified as well, so I'm seeing young adults, that are coming to me because they've got nowhere else to go. And some of them have actually showed up in the pediatric hospitals. All your tests are fine, and they've been sent on to psychiatrists. This is not a psychiatric problem. So I don't think there's definitely not good support services, if any services, for long COVID in children and adolescents in Ireland. And when they are being seen, it's quite sad, the comments that families and kids are making about the bad experience they have dealing with the specialties who are seeing these kids.
Well, I might bring Sarah O'Connell in on that then, because Sarah, I know, as I mentioned, you're working with Long COVID Advocacy Ireland and also Long COVID Kids, and you are only too aware of the lack of services for children. Can you tell us about your own experience and how Long COVID has been a problem, particularly for your own son?
Yeah, so my son Jake, who's 8, got COVID in August 2021 for the first time. So what we now know is, looking back, he developed mild COVID, but things didn't really get bad until his second COVID infection in December 2021. So he became really, really unwell in January and February after that, with profound exhaustion, cognitive problems with memory, concentration, insomnia, muscle and joint pain. He was really, really unwell. And then he had a third infection in April 2022. And so with each infection, we've seen him deteriorate.
And Jack has outlined there how some young adults are sort of being told this is in your head. They're being sent to psychiatric services. What sort of experience have you had with health services?
Yeah, in our own situation, it's been really, really difficult to get care. I suppose I have post-viral ME myself, so I suppose I kind of knew some of the doctors to go to, but almost every single parent that I speak to, and I speak to new parents every few weeks, have had appalling experiences. I mean, being told their child just needs more fresh air, just needs to get out and exercise, needs to drink more water, that their child has teenage anxiety or school avoidance, that it's all in their head. I mean, with the horror stories are just shocking, to be honest.
And how is your son now, day to day? How does he cope?
So he's very unwell. I mean, he's probably considered moderate. There are children more severely ill than him. He goes to school on a good week, maybe 2 days, maybe less. He's profoundly affected by it. Our lives are every day kind of waiting to see how he is, and we feel like we're prisoners in our own home. Maybe at the weekends he can get out for maybe an hour, something quiet activity, and then he has to recover for the rest of the weekend. So it's really difficult. He has neutropenia, low neutrophils, the last couple of weeks, and we've been told if he develops a fever that we need to bring him immediately to the emergency room. So my dilemma is, do I bring him to an emergency room where he is at risk of another COVID infection or a norovirus infection or something else? To get treatment, he has to be introduced into an environment where there are now no masks.
So that is a big concern for you, the demasking.
Yes, absolutely. Yeah.
Jack, just finally on this then, from what you're saying, really, my sense is more urgency is needed, that patients with long COVID, including Sarah's son and others, feel like they've been left behind.
Yeah, well, absolutely. And I think, every time there's a query about what's happening with long COVID, the response from the government is we're doing great. We have all the services. Everybody's, we're doing everything well. We're on top of the science. Everything's going well. But if you listen to patient experiences, it's not that situation at all. So, yes, there is urgency. There's lots of people out there. There's money being put into long COVID. It's not being used for long COVID. And like I said, this is a rapidly changing field. And I would say the long COVID plan for Ireland isn't keeping up with the science. And hopefully tomorrow is an opportunity, at this conference to kind of raise the issues rather than just kind of stand up and bluff and kind of pretend that everything's well. And then finally, we need to involve patients, and there's been lack of engagement. Patients have not been included by the Minister of Health in engagement and, addressing the needs. You need to talk to the patients about what the problem are, and the HSE hasn't done that substantially with the long COVID population.
Well, thank you both so much for joining us this evening. That's Jack Lambert, Professor of Infectious Diseases at the UCD School of Medicine, and Sarah O'Connell, who's a parent and advocate for long COVID. Interested in your thoughts on all of this, 51551.